Hi, I'm James. This is my wife, Rhonda Tomasi. We're the authors of that green book called What Time Tuesday. We're very fortunate today. We're here in Dr. Michael Burkan's office. We're with Jean. And Jean has got one of those sense of humors and attitudes that it really is very endearing to us. But Jean also had reasons why she is meeting us in the office. And Jean, can you tell us, how did you end up in Dr. Burkan's office? What was wrong?
All I knew was I was dizzy constantly, but I had no idea why. And when I went to numerous doctors, I kept getting different answers. The most common response was, let's try a new drug. And I kept saying, I don't want drugs. I want something more than medication.
Yeah.
So finally, my boss, bless his heart, mentioned that he had heard about this Dr. Burkan. So I said, well, I think I need to give it a try. I came in here on a day that it was a partly cloudy day. In fact, thunderstorm clouds were rolling in quickly. It was not a good day. I left here knowing I finally had hope. I left here knowing that there was going to be an answer for me. I knew it wasn't a miracle. I knew it wasn't a cure. But I knew I had hope, and that was the best feeling of anything for years.
Wow. Well, were you suffering from Meniere's?
Yes.
Ooh.
And I had been diagnosed by my family physician and then given a handful of pills.
Oh, thanks.
Yes, and the handful of pills only left me home in bed, lethargic, or feeling very ill.
If you were to describe Meniere's, how would you do it?
Actually, I love doing this. This is one of the things that I said to so many people. Remember the tilt-a-whirl as a child?
Yes.
Eat 10 hot dogs. Make yourself feel really miserable. Go on the tilt-a-whirl. And then come off it and try to stop yourself from spinning. It's this sick, horrible, nasty feeling, and the world just won't quit moving.
Oh.
And that for me is Meniere's.
Oh my goodness. And it would come and leave at its own will?
Yes.
And you didn't know when it was coming on you?
No, had absolutely no idea.
How long would a bout normally last?
It could be anywhere from a matter of a day or two to, the worst I'd ever had was 3 months. That I spent day after day after day literally crawling through the house and going on my hands and knees up down the steps because I couldn't trust myself to stand up. I knew I could end up on the floor at any time.
So forget driving.
Correct.
Forget going to work.
Correct.
In fact, you're married.
Yes.
Almost forget you got a husband.
Yes.
Yes, because why isn't the dishes done? Why isn't it? You're lucky if you were able to get up the stairs, let alone do something.
Right.
Bless your heart. Wow. So the answer was more drugs.
That's what their answer was.
That's what their answer was. More drugs. Was there ever a talk of getting an operation? Or
yes.
What was that all about?
The doctor had strongly recommended I check with a surgeon, and they wanted to do the complete ear deconstruction. That was the first option I was ever given other than the medication.
Right.
I have been through 11 operations in my life, and I've had cancer, and I've had a number of things that have happened, and the last thing I wanted to consider was one more operation. And when they told me I'd be deaf, and then you could still end up with problems on the other side, I thought,
what's that all about?
When did the tattoo appear on my forehead that said stupid? I didn't remember putting it there.
No.
So I said, absolutely not. There has to be another alternative. And I don't like taking drugs. I don't agree with it. I'm not comfortable with it.
So in conclusion, I'd just like to ask, in what ways has your life changed?
Oh, go.
Take your time.
For it, girl.
There's absolutely no comparison. It came on so slowly and so steadily that I don't think I fully realized how much I had lost or how much I had given up until I started to feel well again. And then suddenly it was this sense of almost rebirth. And I know a lot of people look at me and think that's just a little extreme or that's just a little hokey. and they can think whatever they would like to. It was
That's
my
okay.
life that came to a
That's
screeching
right.
halt, and
Yeah.
for me this has just been fabulous. I don't have a fear anymore of what's going to happen next. How am I going to get through this? What's going to happen the next time I end up on the floor and don't feel like I can make it again? I know that there's hope. I know there's that light at the end of the tunnel, and I know I can go back to living a normal life and keep my job and make plans with my friends and ride my bike and do things that I was too afraid to get on a bicycle. I could not
Well, of
think about
course,
doing
yeah.
something like that.
One of those things come upon you.
Right.
Man, oh man.
Rollerblading, doing all the things that I love to do. Just going for a walk with my dog. I took a cane with me because I was afraid if this hits,
Wow.
how am I going to get back home?
Wow.
I never liked cell phones. I never liked that type of thing. I never wanted to be that tied. But I carried a cell phone everywhere, and it never left my pants pocket. I just couldn't imagine what would happen if I didn't have it with me. So knowing that now I can walk out the door and leave the cell phone behind, I can walk out the door and leave the cane behind, I can race the dog around the yard, it's just fantastic. It's a blessing beyond anything I'd hoped for.
Dog's pretty happy too, right?
The dog's thrilled.
Any other thoughts, Miss Tomasi?
No, we just want to thank you for being here on an off day. I know you had things to do, but we count it a privilege to hear your story. And we know that what you have to say will touch other people that are in the similar conditions or the same. And we just thank you very much.
Well, I thank both of you because you've both touched me. I've seen the DVD and I found it very inspirational and truly wept at one point thinking of what your life must have been like, and because of the relationship yours as well.
Yeah.
And I've been very touched by that, and I thank you both.
You're welcome. Thanks again for coming.
You're welcome.
See you later. Talking with Jeffrey and Vicky.
I can just start to feel the fullness in the ear. It starts to, something's not quite right. You know, I'm really sick. I couldn't
That
go
was
out.
a come get me day.
It was where I called her, come and get me. I says, I'm out behind the gazebo. I'm not doing well. So all these people at the nursing home are looking at me like, what's wrong with this guy?
guy's
You know,
crazy.
I'm out
What's
laying in
wrong?
the grass and
Not
And
doing
that,
well, an
so-
embarrassing
Drink
moment.
too much. Or
well,
something?
that's what
Not
it
one of
looks
your
like.
proudest days. Avenues.
Oh, I've
things that we
scared.
worked through.
I've scared entire coaching staffs that I coach football with. I went to the Cleveland Clinic. They sent me there, and that's when they told me you definitely have Meniere's. What we have to do is actually remove your whole inner ear. You're going to be in the hospital for a while because you got to learn how to balance, only having one side of your
That's right.
balance mechanism there.
That's right.
And I said, "Gosh, I really don't want to do that."
It's like
And so,
starting all over again.
Well,
Yeah.
no, the surgery was super scary.
yeah.
To think about all the possibilities of what else if something else goes wrong, and what will you be left with? There's no guarantees. We all know surgery never has
Wow.
guarantees.
No, it doesn't.
So you take it. I told him, I know you're feeling really horrible. This is not a time to make a decision like that. So
Yeah.
let's just wait.
Yeah.
Maybe it's time for you to get back on the website and see what new has transpired.
Yeah.
And luckily, the gentleman that put the post down there, and there was 1,000 hits on that, that's where it all led.
It started from there. And what was that post? That was pretty interesting.
It was a guy, and he lived in North Carolina, and he went and saw an upper cervical specialist that took care of his Meniere's for him.
Okay.
And he says, I've tried all this stuff, and he listed everything that I've been through.
That you were well aware of.
And
Yeah.
because I got very educated in Meniere's, because everybody called it the mystery disease, nobody
Yes.
knows what causes it,
Yes.
how do you get it, or anything. So I went on this website, and a guy was talking in Carolina, and he just happened to mention in one of the lines was one of the best in the United States with the Meniere's is Dr. Burkon in Grand Rapids. I said, Grand Rapids, I can do that.
Wait a minute.
You
I
know.
recognize that.
Yeah, I
I
said,
know
I'm on the
that.
other side of the state, but I'll gladly go over there.
We can try this.
Yes.
And when it came back in February or March is when it came back, and I was really seriously thinking about the surgery. And when I found this and called here, they squeezed me in that Friday. Come and go.
Yeah.
And he's even told me it's 6 weeks when I first came here. He says, you'll be doing a whole heck of a lot better. And he was right. And we're just trying to figure the right stretch of getting me back aligned that we can go. And I think 5 weeks we stretched it a little bit too far this time.
Because everything else we tried was we never got the results
You
that we
repeat
had
it,
gotten
yeah.
from this. Never.
At least now, if I call it getting vergy, where you can kind of feel it coming and it's not going to hit. I'll have those, whereas before, when you feel it coming, you'd have it. And then you'd feel lousy for a day or two afterwards. Now,
So would you recommend Dr. Pecan?
oh, absolutely.
By the trainful.
Absolutely. Trainful,
By the
yeah.
trainful.
The thing is trying to find the people. I mean, you just talk to people and they'll say, well, I know somebody that's always dizzy. They say they got vertigo. And I said,
Yeah.
you might want to get checked.
Yeah.
Because I'll start asking some questions. Do you have this? Does this happen? Do you get the sweats? Do you get nauseous?
Your
And they'll
family
say,
doctor
yeah.
doesn't really know. They can, they begin, but it took us, I know it was more than a year before we knew what was really wrong.
Yeah.
You know, everybody was guessing. It was trial and error. You know, well, you heard
We don't know.
vasodepressor syndrome, autoimmune
Yeah.
inner ear
Inner
disease,
ear
to
disease,
Meniere's.
To,
Finally, Cleveland Clinic said, well, it's Meniere's, but there's not much we can do. We can treat symptoms, we can give you some medicines. Antivert for the dizziness, I tried that, it didn't work.
No.
They say, wait till you get dizzy and then take it. Well, I'd take it and then...
and the symptoms of taking a drug could be dizziness.
Yeah, and
That's
you
the
read
funniest part
on
of
the
it.
drug bottle, it says it could cause dizziness. It says, this is good, you take a pill that could cause dizziness to take away the dizziness. I think the other Meniere's people I've talked to, everybody has had a trauma way back. Not just, everybody thinks, oh, that happened 2 years ago. Well, mine happened 15, 16, 17 years ago. I fell
My
out.
ears were full all of the time. I would get up in the morning. By the time I would do my hair, put on my makeup, and get ready for work, I was done. I was tired. I had to rest. I had to take the weight off of my upper cervical spine. And I would have to do that every few hours. Even at work, I'd have to lay down in my office and just take the weight off from my neck. It felt like my neck couldn't support my head. And I'm quite certain now, after learning what I've learned through going through this, it's because I was not aligned properly and my upper cervical spine couldn't support my head, and that's why I was having the pain, the fullness in the ears, the dizziness, and I even had vertigo on a few occasions. So it was actually pretty scary.
Whoa, yeah.
Teacher, I was moving a shelf and I lifted up my head and I went into a full-blown attack. I mean, I started vomiting immediately. It was horrible, and I hadn't been the same since that day.
When you say attack, first, I know, unless someone out there listening to you has had Meniere's, or they know of someone that had Meniere's, probably don't even know what you're talking about when you say Meniere's attack or Meniere's disease. What is a full-blown Meniere's?
It's severe spinning. I mean, vertigo, it's more intense than vertigo.
Okay.
It's a severe spinning, like the room is spinning completely, really fast.
Wow.
And I immediately get nauseous. I can't walk.
Of course.
You get sick. It's horrible.
You're just like dizzy, and you
It's
can't.
more than dizzy. It's not.
worse?
It's not the same as dizzy. It's intense spinning.
So what were some of the conditions that you had that you've seen a change under upper cervical?
The immediate was I had been experiencing halo vision,
Okay.
and with
Experiencing what?
halo vision, which is associated with migraine headaches. I had the migraine headaches, but which were at some point
Pretty bad.
I would lose evenings, days, to where I would want to sit in the dark. But then I started getting the halo vision to go with it, and that's when I started getting a little more concerned about it.
Could you explain that halo vision?
You see a bright zigzag light wherever you look, and it can last for as little as 2-3 minutes, or I've had it last for as long as 10-15 minutes. And and I've had headaches with it, and I've had it without having a headache. And it's kind of an eerie thing, because even when you close your eyes, you see it. There's no escaping it. And I started experiencing that, and it started coming on probably as regular as 2 to 3 times a week.
Really nothing wrong with you.
There's nothing there. Like, I was having seizure type episodes where I'd arch my back, and I mean, I'd sit there and you'd tell me something, walk out of the room, and I'd forget exactly what you said. I couldn't remember stuff. I couldn't remember my parents' names. I couldn't remember girlfriends, sisters, anybody's names, anything. So I mean, at the beginning it was really frustrating, you know. Then I started getting really depressed, thinking, you know, this is all in my head. Yeah.
So like it was really your fault?
Yeah, like I was making it up or something.
Oh, wow.
It was. I mean, I ended up spending time in a like mental hospital or something because they thought it was all in my head. Maybe that would cure it.
I have TMJ, I have some jaw pain, I was having headaches and pain in my neck and back, and
Ooh, bless your heart.
yeah, since I started coming here, my headaches have all but disappeared, and I was actually in a car accident a few months ago, and I felt like I digressed quite a bit, but I'm finally starting to get back to the point where my jaw is, I don't have a whole lot of pain, I don't have a whole lot of headaches, so.
I was really wondering whether I should go to an upper cervical because I was lower back. So that was the first thing when I called was, you know, I know he's upper cervical and that's great, but I'm way in the other end. And he took x-rays and he pretty much said I had whiplash in 2 places. Have no idea how I got that. And my lower back, as far as disc went and everything, was healthy. It was just, my alignment was so bad that I was 2 inches shorter on one side than the other. That was why I was very uncomfortable.
Wow.
That's right.
Yeah.
So I've gone there I've gone to Dr. Bakan for 9 months, and my back does not hurt. I've always stretched.
Yes.
I stretch now. I stretched before. You know, just a little. Like I said, my back doesn't hurt, and I feel great. That's why I'm here.
You just want to let the folks know that you're doing okay.
Yeah.
Now, how did you find the Health Talk 1? How did you get a copy or watch it 25 times? Oh, was it?
Yeah, it was on cable all the time.
And you kept watching it?
Yeah,
watching
bits
it,
and
like,
pieces. I thought it was so interesting.
Yeah. They're not talking to me, though. They must be talking to somebody else. Finally, he goes, yes, we're talking to you.
Right.
How sweet. So you're better.
Yeah, and I have much better range of motion.
Yeah.
Like I said, I had whiplash in 2 places. I didn't know. So now I'm going like this, going, wow. I feel like I have WD-40 in my neck.
It wasn't. I was just staying off caffeine and salt, you know. And
Yeah.
I said to the specialist, what can I do? And he said, well, you have to have faith. And I said, well, I do have faith. And he said, and you also have to have people praying for you. And I said, I do have people praying for me. And anyway, my best girlfriend was over one day, and she saw how sick I was. And so she was telling another friend from church about me. And this other friend said, well, her daughter went here to Dr. Mike. And so she called me up and gave me his telephone number, so I called him. And so that's how it all came to be.
Would that be Dr. Michael Pecan?
Yes.
Yes. Isn't he wonderful?
Wonderful.
Yeah.
And he said to me right off the bat that he would have it under control within 6 weeks, and it only took 4 weeks.
And then I'd gone in the meantime to the Michigan Ear Institute, and they recommended surgery for my ear. And
is that kind of like that drill thing that we read about?
it's the endolymphatic sac decompression, and what they do is they cut behind your ear.
You are a teacher.
Yeah.
Yes.
They cut behind your ear, and then they pull it out, and they shave part of the bone back here because there's a sac in there that absorbs fluid,
Right.
and it's supposed to open it up and make more room, except it doesn't work. And I mean, I've read people that have had it, and
Yeah.
you get to the point where you'll try anything.
Right.
So I was going to try this, and then I had read about Dr. Burkan on there, like I said, but I hadn't gone to him. And he is a principal, and he came home like the day I was ready.
This is your husband, Craig.
This is my husband, Greg. Yeah, he's a principal, and he came home. It was like the day I had decided I'm having the surgery because nothing else was working.
Wow.
So he came home and said that one of his teachers' fathers had come to Dr. Burkan. And so I said, well, let me check out his website. So I went to his website, and that day he was having the Meniere's clinic like he's having today. It was in November. And so I called up and I said, what is it and can I come? And I came and I had my first adjustment. It's got better every week and I haven't had an attack since that Sunday one, which he's given me my life back. I couldn't drive. I couldn't work. Like I said, I'm a teacher.
Yeah.
I was using up all my sick days. It was awful. And all I would do is sit at home in a chair and just sit. And I couldn't eat. Couldn't walk. I used to be a runner. I would run 2 marathons, and everything was awful. And I thought that's the way I'm going to be for the rest of my life now. But
And you have missed a day of work since?
I have not for that. I've missed for other.
I've tried every other doctor, neck doctors, head doctors, eye doctors, crazy doctors, everything. So I was like, you know what? I'll give it a try.
Why not, right?
Yeah, might as well try it all. And I walked in here and I was skeptical at first. I was, who's not going to be, you're just adjusting your head just a little bit. I was like, it can't be, stopping it. It can't be, causing all the problems. But after the first, time, it was feeling a little bit better. Then I went and worked for 2 days, came in again, worked for, 4 days. Then it started, a week.
Whoa.
Yeah, and then,
whoa.
Now I was up to probably 6 months of having these seizure-like episodes. And after probably a month, 2 months of coming here, I haven't had a seizure since.
And that's been how long?
I haven't had a seizure in probably 3.5 months.
Wow.
Life-changing,
Yeah.
isn't it?
Yeah. I was, before the accident, I was on my way, scholarships and all that stuff, and then everything dropped, and I thought my life was literally over.
Yeah.
I'm not going to be able to go to college because I can't remember anything. I'm not going to be able to do anything,
I can't get a girlfriend because I won't remember
I can't remember her name.
I
I can't, How am I supposed to take her out, Hey, what's your name again?
What was it?
But after coming here, then I'm getting, memories back, and, I notice the longer I go without these, the longer I go without adjustments, maybe something would start to fall back in place to where I couldn't, think quite as clearly or whatever. But our Dr. Burkhan worked me right in. He'd come in on Saturdays, he'd come in early in the morning if I was having real problems. I was having a seizure once and call him, and he got me right in that day and took care of it. And,
Wow.
I don't know, it's really life-changing, like you said.
It really is. I wanted to say also, too, how fortunate we are here in Grand Rapids. We have a doctor, an upper cervical doctor here. And that if all of us were to go to Wyoming, there's not one in the entire state. There's only one now in Mississippi. He just moved in. The whole state of Mississippi now gets to share one. And here we are, Grand Rapids, west coast of Michigan. And we've got an upper cervical legs. Very fortunate.
We are very fortunate.
Very fortunate. For you especially, I'll
For me
say.
especially. I've gotten my life back. I really have.
You did, yeah.
I seriously was considering permanent disability.
Oh, yeah. Well,
I couldn't produce any longer.
No. And when you lose hope, now you're almost hopeless, and you just say, well, what else can I do but sit around? And I don't want to, but that's my lot. But it wasn't for you. And now you have a great opportunity to let other people know. I want to thank you very much for coming in today and taking your time to do this to help spread the word through patient advocates, upper cervical patient advocates, to spread the word to those all across the nation who are in the same position you were in, or Rhonda or myself was in.
I'm happy to.
Thank you.
And I had trigeminal neuralgia diagnosed, I'm going to say about 2 years ago. And through the process, my doctor started me on anti-seizure medication. It kept getting worse. Started out at 300 milligrams, and within about a year, I was on 2,700 milligrams.
Bless your heart.
My career is a mortgage planner. Tough environment right now, but you have to really be on your toes to be able to do that. On that medication, I was dysfunctional. I was driving. Nobody told me I shouldn't be driving. I realized that later. my mother-in-law's neighbor happened to be watching television one day. Health Talk came on. You guys were there. She recognized trigeminal neuralgia. She knew that's what I was dealing with because they were watching me as I deteriorated.
Yeah.
And my life was becoming less and less fun. And I do like to have fun.
Yes.
And she taped it. I consider that a miracle.
We consider that a miracle.
I came in, had my first adjustment, and I knew immediately something was right for a change. When he adjusted my neck, I saw lightning. He explained that was the first time those nerves had worked for a long, long time.
Yes.
But I asked him how I could get off of my medication because it was a step-down process. It took 9 weeks. In 9 weeks, I was no longer taking any medication. And for right about a year now, I am on 0 medication.
Congratulations. That is wonderful.
Hi, I'm Rhonda Tomasi, President of International Upper Cervical Patient Advocates Association. Today I want to share a few of the marketing materials that we make available to patient advocate members in case you have an interest of being active on your local grassroots level. And on the inside there's a list of conditions that that person most likely has or someone in their family. For instance, depression, TMJ, menopause and PMS, fibromyalgia, infertility, irritable bowel syndrome, migraine headaches, arthritis, diabetes, carpal tunnel syndrome. Those are what we have for women. For children, AD, ADHD, autism, bedwetting, ear infections, epileptic seizures, ear and eye infections, hyperactivity learning disorders, constipation, and colic. For men, we listed Parkinson's disease, restless leg syndrome, dizziness and vertigo, Meniere's disease, high blood pressure, Tourette's syndrome, sciatica or lower back pain, neuritis, neuralgias, ringing in the ear, and tendinitis. We have personally met people that had these symptoms and they no longer have those conditions any longer, or they're under care and improving. Even like the MS, I've personally met people that were in wheelchairs with MS diagnosis and they're not any longer. So I'm very comfortable in the conditions that we listed on the card. In another packet, there's a little card and it invites you to go to upcspine.com and post your story. We're right now looking for volunteers who are willing to speak either by email or phone with patients who are or people who are inquiring about these conditions that we just read to you. We need people that have been under care, they're willing to share their story and bring hope and encouragement to people who are interested in upper cervical. Not only through our website is there a survey, but a new website has been launched with a movie that was produced by 2 other upper cervical patient advocates. One of them financed the movie for $250,000. The other one is the wife of a producer in Burbank, California, otherwise known as Hollywood. Storyville Studios directed and produced and hired 60 Minutes film crew to produce The Power of Upper Cervical. The movie's available on our websites, Upper Cervical Patients or uppercervicaladvocates.com, whattimetuesday.com, or thepowerofuppercervical.com. Of course, we've included one of James's books, What Time Tuesday. What Time Tuesday is available on both websites that I previously mentioned. And it's James's story of dealing with trigeminal neuralgia. Again, I'm Rhonda Tomasi, President of International Upper Cervical Patient Advocates Association, IUCPAA. Thank you.
My name is Jim, and I have Meniere's disease, and I came to see Dr. Burkant about a year ago, and I had a lot of fullness in my ears at that time, and it was quite remarkable. After some fairly aggressive adjustments over a period of several days, the fullness in my ears largely went away, and I'm back now for my 1-year checkup. And based on some of the thermal data that he showed me, I am basically in much better condition than I was when I initially came for my first visit 1 year ago.
Thank you for coming. I think the first question a lot of people had is, what do Meniere's and trigeminal neuralgia have in common? Well, I think one of the first things that it has in common, it's really difficult to get a diagnosis. It takes an average of 2 years of trying really hard to get either one diagnosed. I know that in trigeminal, over half the patients get some, if not all of their teeth pulled before they get a diagnosis. A lot of times it comes on after dental work, so you go to the dentist. The dentist might do a root canal that doesn't work, so he pulls a tooth. That doesn't work, he pulls more teeth. Finally, they start sending you around to neurologists. It's sort of the same with Meniere's. You can go to several doctors before you get anything close to a diagnosis. The testing is unpleasant. Some of the tests they do for Meniere's is they'll blow hot and cold water and air into your ear until you get really sick. So you go through all of these tests, finally you get a diagnosis, and then they tell you what your options are. Well, you might start with a lifestyle change. They might say in Meniere's, cut down on salt. Good advice for all of us. Helps a little bit. Then they go on to pills. None of these pills are made for Meniere's. They're just cover up individual symptoms. For some people, some of them help. That's fine. And then on to the surgeries. The surgeries are expensive. Long time getting better after the surgeries. Low success rate. Lots of bad possible side effects with Meniere's: deafness, trigeminal possible blindness. It's a very bleak thing. It's depressing. It causes anxiety. Meniere's disease got its name after Prosper Meniere. He was the head of Paris Institute for Deaf Mutes. He described one particular case of a young woman. Later it became called Meniere's disease. Now, I don't know who decided to do this, but they dug her up and did an autopsy. And they found out she didn't have Meniere's. She had a cancerous tumor in her ear. So the first Meniere's patient was misdiagnosed. So Harvey Lillard was the first chiropractic patient. And Meniere's patients will be interested that he got an adjustment of the second vertebra in his neck, and it cured him of deafness. He was deaf from an accident many years before. So he was adjusted by D.D. Palmer, who was a magnetic healer. There were more magnetic healers at that time than there were MDs. They would use magnets, or they would use their hands as magnets, whether they wanted to put energy in or take energy out of the body. If you have a kink in your neck, your head will tilt. If your head tilts, you'll get dizzy. Your body will shift the pelvis to level that. One leg will look short. Can anybody see which leg looks short? Right, been kind of subtle, but when you do it all day long, that wasn't. That was a left cervical symbol. So you can go ahead and get up. I appreciate your participation. We'll be doing more of this later. So you can do this laying. Some doctors like myself do it face down, some face up. If you think about it, while you're just gently turning your head and you're lying down, you're outside the effects of gravity. There's no reason for your legs to change length. There has to be something out of place in the neck. So this is an oversized model of C2 axis, the no bone, that fits in there. This rotates. This one rocks. That's how you go like this. That's where the term off your rocker comes from. Two articulations. one slips out of place, and this bony mass puts pressure on the brainstem. That's where the nerves that go to your face and your ear originate. The brainstem is this big, the tip of your finger. So depending on the way that bone moves out of place, it could put pressure on either the trigeminal nerve going to your face or the 8th cranial nerve that goes to your ear. They're about that far away. I can't hardly show you how close they are. It's also very close to the nerve that goes to your gut, so it can make you sick. So people that have these problems usually have other problems too, digestive problems, trouble sleeping, migraines, they're all related. Okay, so what do we do? What upper cervical specific chiropractors do? We do a really detailed case history, and I'm really looking for trauma. Trauma that happened many years ago. I have to practically beat it out of you because you're usually not forthcoming. We didn't bring the Titronics instrument down here because I'd have to recalibrate it. We will be using it this afternoon. It does a heat picture of your neck. Easier to explain it when I show it to you. There'll be an instrument that's newer that's discussed here today that I saw at a chiropractic show recently that we may be using in the near future, and I'll wait and let them discuss that. Dr. Krill, we do his leg checks. We take some x-rays. We do not adjust without x-rays. We establish the pattern of your problem, and we only adjust when that pattern's there. And when the pattern goes away, we stop adjusting. Pattern like the right leg being ½ inch short, the upper neck being hot on the right. Some of this stuff will make more sense. We rest you, and then we recheck you to see what happened. We don't just send you on your merry way. This is the first electroencephaloneuromentimograph. And yes, I did have to practice that before I even say it. So we believe the structure affects function. I'm more likely to go to a DO than an MD because they have more appreciation for that. So I think the most common cause of Meniere's is a posterior inferior atlas. That's the top bone in the neck. That means the bone went backwards, the head went forward or off to the side. Almost always caused by trauma, not just wear and tear. So it's irritating the 8th cranial nerve. It's also irritating the eustachian tube, the auditory tube that goes from the middle ear to your throat to balance the pressure between your ears and the outside world. And because it's plugged up, the muscle isn't working right, there's pressure in the area, this happens too slowly. And that's why getting up quickly can make you dizzy. This is why a big storm front coming in and the barometer drops can make you dizzy. Flying can make you dizzy. Things that usually it adjusts very quickly, adjust very slowly. So this shows what I showed before, where the atlas moves backwards, putting pressure on the brainstem right where it meets the spinal cord. So again, with Dr. Blair, instead of just drawing a line through the middle and pushing this all around, he actually studied each of these articulations separately. If you have unilateral Meniere's, a problem on one side, one of these is slipped off. If you have Meniere symptoms in both ears, probably both of these have slipped off. You've either had two traumas or one really serious trauma. So Blair x-rays, they take about a dozen shots. I've sort of abbreviated it. Most of my patients have very dramatic misalignments, like the one that we saw yesterday. A lot of times it's a millimeter. A lot of my patients it's a ¼ inch. You don't have to take a dozen x-rays to find it. If a couple x-rays, 3 x-rays don't show it, that's the minimum I use because we're looking at a 3-dimensional structure. Most chiropractors might take 2 x-rays, but you can miss something. If you take from 3 different angles, you'll usually see what you need. The doctors, we're looking at underlapping, where this will underlap if it moves forward. it overlaps. In trauma cases, it usually goes backwards. Those patients are usually more symptomatic. Those are the people that walk into my office. It has 4 listings. 2 if it goes forward, it either goes a little left or right, and 2 if it goes backwards. Most of my patients, it goes backwards. This gives you just a sample of what a side posture adjustment looks like. That is when the head goes to the side and you're adjusting atlas here with your pisiform. It's a little bit tricky. There's a head drop here to make it comfortable and more effective. It's not painful. So, this is a typical picture of a subluxation right there. You see these outside edges here line up? It's underlapped here. The bone's gone that way. You do an adjustment to push it back, re-x-ray, and they line up. You see it takes the ones below it with it. The bottom ones were not adjusted. It's the top one in this case. The head is straight, and the patient's not dizzy anymore. The body, the brainstem, expects the eyes and ears to be level to the horizon. If you have a kink in your neck for a day, a week, or a month, it's fine. But after years, something is going to go wrong. And either pain in the face and or dizziness are some of them. We do have a few patients that have both trigeminal and Meniere's. I had one patient started for Meniere's. I didn't even know she had trigeminal. She didn't mention it. And she said, "Oh, thank God, Dr. Burkhan, that I got Meniere's disease." I said, "Really?" She said, "Yeah, I don't have to take OxyContin anymore because my trigeminal pain's gone." I said, "You didn't tell me you had trigeminal neuralgia." She said, "I thought you only treated Meniere's." Which brings up a point. Chiropractors don't do different adjustments for migraines and Meniere's and trigeminal. We do the same checks and the same adjustments. It's just that different people get different symptoms that are signals that you need to get some help. So how my research started, I wrote that first paper 10 years ago. The first one I did on 3 patients, then I did one on 10, and then on 100, and then another on 100, and it just kept growing. I started in the beginning, speaking mostly to chiropractors, and then I thought medical doctors need to find out about this to give their patient options. So I switched and did mostly medical conventions. So one of those first patients got in this book, and I'm so proud of that. If there's any chiropractors watching out there. So this is the first scientific poster I ever did. I got invited to do this at Beverly Hills at the Ear Institute, and it was kind of a hoot because they asked me to do a poster presentation, and I said sure. And then I called up my research teacher from school. I go, "What's a poster presentation?" He goes, "Oh, it's kind of neat. You make up a big fancy poster. You stand by it. People come by and ask you questions." Oh, well, it was fun. So then I got into the Prosper Meniere Society. These are mostly doctors that teach ear surgery. Doctors from Europe, the United States, South America. And they usually meet in Austria in the mountains because they have meetings in the morning, ski all day, and then have meetings at night. And then I got asked to talk at the Cleveland Clinic. This is the coolest room I ever talked to. So usually the problem is atlas, sometimes it is axis. When it's atlas, your main symptoms are usually vertigo with nausea leading to vomiting. You can have more ear problems like full ear or terrible ringing in the ear. It's not always ringing. Some people hear radio stations, other peculiar noises. If it's more the other ear stuff, it's usually the main subluxation is C2. They're both the upper cervicals. It's all part of an upper cervical subluxation complex. There's a lot of aspects of this. These bones are so intimate because this dens goes up there. If one of them is misaligned, the other one is. Usually in the same direction, easy to fix, sometimes in opposite directions. called a variable heart defense. So you can see that the vast majority have posterior inferior listings on the opposite side of the involved ear. You don't jump to this conclusion, but you keep it in mind when you're analyzing the x-rays. Some of the literature says that men and women have equal frequency of Meniere's, but a lot of the literature says more females have it. Does anybody have a guess why some of the literature would say more females have it? If my hypothesis is right, that it's by trauma, we're both subject, equally, possible to have trauma. Yes?
Because men have selective hearing.
Thank you. That's good. Yes? Yeah, women say, I want a diagnosis or else, and guys say, I'll toughen up. Exactly right. I used to say that one possible cause was whiplash, and I started saying the most common one was whiplash, but I have evidence that all my patients have whiplash. I personally believe that is the cause. That is my theory. So a lot of times with these patients, the atlas is jammed right up against atlas and stuck there. It's fixated, just like this is sitting there. And we do an adjustment to open that up. That might not seem like a big deal, but boy, do you get a lot of relief, and very often quickly. So I was saying now sometimes there's a problem down lower. When you get whiplash, sometimes a bone in the lower neck pushes against the spinal cord and cause other problems like pain or numbness in your hands or arms, for instance. This is translation. If you get rear-ended, your head gets stuck forward. If you get T-bone, and of course there's other possibilities here, but we're generalizing because we're about 5 minutes here. If you get T-boned on the side, your head usually gets stuck off to the side, a little harder to fix. When you're pushing this bone back, you're going with the articulation. If it's gone to the side, you can't push as hard. You have to use a lot of torque. It's a more difficult adjustment. It takes years of practice to get good at it. But these are the types of changes that you will see when you get these weird kinks in the neck. It's pushing on the spinal cord. Your head is heavy. It gets stuck to the side or forward. It's pulling all of the time. It's pulling on muscles, tendons, ligaments, and on the spinal cord itself. The reason I think the correlation hasn't been made by most doctors is because it takes an average of 15 years from the time you hurt your neck till you get your first symptom. This is a questionnaire I use for Meniere's. You'll see that the improvement at 6 weeks in vertigo is dramatic. Not as much with the hearing loss and the ringing in the ears. Even more improvement after 1 year. And after 2 years, these 139 patients, and this was dizziness and vertigo together, and then in talking to them, almost all of them said they had no vertigo anymore. But there was a little blip there because they still had a little dizziness. The most common cause of back problems that I see is a long-standing neck problem because you're walking around with a short leg and a weird gait, unequal loading on the discs in your back. So it puts uneven pressure and it causes a disc problem. So even the most common cause of low back pain is a neck problem. If you have an injury right to your back, then you probably need treatment on your back. Anything that takes you out of a normal gait when you're walking can throw you out to kilter. And again, for a short time, it doesn't do any harm. But everything's connected together. That's why chiropractors, no matter what you say is wrong, they look at the whole body. I think one of the reasons I have a lot of success is on people's first visit, I say it's 45 minutes. It's not uncommon for them to be in my office 2 hours. We just keep looking and checking and checking. I've been to medical doctors before that only allow one chief complaint per visit. If you have a second one, you've got to come back again. I have people that come in and tell me they have an ear problem, eye problem, their neck hurts, they have a numb hand, they have a backache, their knee hurts, and the top of the other foot hurts. Well, to a medical doctor that's in a hurry that's going to give you 5 minutes, that's a hypochondriac. But the problem could be in the back, it could be in the neck, but upper cervical doctors start in the neck. Atlas is the most common place to get a subluxation. It's the worst place to get a subluxation. If you fall off a roof on your back, and you break your back, and I had a patient that came in to see me, his wife brought him in, and he had a broken back, and I said, you need to go to the hospital. And he went to the hospital, and he got back surgery. Then he came back, and I worked on his neck a little bit, because he also screwed up his neck. There are chiropractors that will adjust the occiput. It depends what school you go to. We're dealing with the articulation between atlas and occiput. It can cause problems in the ear or the face. It usually lights up the trigeminal ganglion on a PET scan on any of these. I'll be frank with you, it's easier to control Meniere's. Trigeminal isn't just inside of atlas. There could be a problem farther down in the neck, farther up in the brain, or somewhere in the face in addition to this. So it can be a challenge, but these are subjective diagnoses. Every case is a little different, but they often say they feel pain or pressure in the occipital region in addition to in the face. These nerves don't like to be pushed on. Good question. 1 out of 3 people that get TN kill themselves. Can you imagine? 1 out of 3? There's only 2 out of 1,000 people that get it. That means that only in Kent County 1,000 people have Meniere's and 1,000 people. That means that 300 people will probably commit suicide in our county from trigeminal neuralgia. 300 individuals. You don't hear much about it because it's kind of kept quiet because, you know, they were in a lot of pain. You know, it doesn't get discussed a lot. It's just very unpleasant. This stuff is so hard on the family members. It's not just the person that has it; it's the caregivers. That's why you're invited here. Yeah, sure, for better or for worse. But if you become a nurse instead of a spouse, some people can handle it and are really good at it. My hat's off to them. Leads to a lot of divorce. I mean, the things that this goes on for years, it's just all sorts of horrible things happen. It's just, there are some lists on my website. The Tomasis have lists. Greg Buchanan, a patient and friend of mine that's been here and spoken before, and he's flown me over to Australia. Has a great website on upcspine.com. Just a word of warning, there's a lot of lists of upper cervical chiropractors, and some of them, you give them $100, you get on their list. What some people do is they come here for a few times. We come up with a listing, we sort of get the problem under control, we find out what works, and then together we look for a chiropractor that will pick up where I went and left off. We give a report. Some chiropractors are willing to do that, some aren't. But that kind of will show you what you want to look for as a chiropractor. It doesn't adjust a lot, it checks a lot. But you don't always get adjusted when you go in. That rests you after you get adjusted. If you start understanding the difference, you can start asking around and you can find someone that's specific. Okay, Jedediah, will you just say a few words? We're a little bit behind here, so I'll ask you.
Yeah, I'll keep it brief. Well, good morning. As he said, I'm a little bit unique in my standpoint because I'm a third-generation chiropractor and I'm the 25th to graduate from Palmer. So he was telling you a little about B.J. Palmer. My grandpa actually knew him. And, actually got a bunch of books signed by B.J. for my graduation. Yes, that was a nice gift. So I'll tell you a little bit about my story. A lot of my family are full spine chiropractors and they do a little bit of upper cervical work on the side. And I remember when I was in college asking my dad about his best cases and what he did. He was always like, oh, well, I toggled that guy. Well, toggle is just the technique, one technique of upper cervical, which I didn't know at the time. And so that kind of got me thinking. And I went back home to Alaska, and then I went to Malaysia for a while, and went back to Alaska, and I worked in a big $1 million clinic, and I was quite busy. But we were not addressing neuralgias like this, and that kind of bothered me. I said, well, BJ Palmer, what Dr. Burkhan was talking about, he was into making sick people well. He was not into making somebody come back for their weekly adjustment for the rest of their life. That was not chiropractic. BJ was interested in taking the pressure off the spinal cord so that you could actually fix something. And by fix them, I mean they might come in and get checked next month, but they don't need an adjustment. They're just checking. Kind of like going to the dentist and they don't have a cavity. They're happy when you don't have to adjust it. So I'm happy to say that I finally found Dr. Burkhan. He is a great mentor. And in the last year, I'm from Ventura, California now, and I have done this technique on probably about, I just counted before I left, about 340 some people. And there was only 5 that did not clear out. So if that tells you the results, I'm not saying my adjustment is anything special. I'm not saying I'm any better than any other chiropractor. What I'm saying is the technique works. Upper cervical works. Why does it work? Because we're not treating a disease. We're not treating a symptom. You come in with symptoms, but we're checking what's wrong with the body. And when you take the pressure off the brainstem, it really can't heal. And the biggest thing for me as a chiropractor, and I don't know how many chiropractors are watching this on the internet right now, but we were talking about this before, adjusting is kind of addictive. And you have to be very careful that you do not adjust the atlas too much, because it only needs adjusted very infrequently and in the right vector. And something that I want to mention, he showed you a picture of an atlas adjustment. Some people are scared when they see that table. They're scared when they hear the noise of the table drop. It takes 18 pounds of pressure to crack an egg on its side, a raw egg. And it takes 21 pounds of pressure to drop a zenith rock table. We practiced at Palmer to torque and drop that table with a raw egg on it and not crack the egg. You might say that's impossible, but he was just telling you how a side posture adjustment torques. So what you have to do is you have to practice. You can hold out your palm, torque your arm without moving your palm. You can just try it. That's how you practice. Try to not move your hand, but torque the muscles. That's what he's talking about, practice. When you see an upper cervical chiropractor, they're not just a chiropractor that goes and crunches you. They're a chiropractor that has practiced this for a long time. And so I would just like to mention for your case, sir, that actually works a lot down in California because, as many of you know, California has a little worse traffic than Michigan. And they don't like to drive from LA to Ventura all the time. So what happens is, just like Dr. Burkhan, sometimes I will get somebody started and then we'll find them a chiropractor that can help them there. So wherever you are, wherever your friends are, wherever your family members are that have these conditions, we can find them somebody, we can help. They may have to come to one of our doctors first or someone that we know to get started, but this is something that can be done all over. Yes, and this is the technique, like Dr. Burkhan was saying, that it's not only for Meniere's or trigeminal, it's for a lot of conditions, a lot of neurologic conditions. If you know anybody that has a one-sided brain condition, or they seem to always be weak on one side of their body, there's actually quite a good benefit that can come from us for that. So, oh yes, sir. Now, that's a good question. I've had actually 3 seizure cases in my office. 2 responded quite well, and 1 responded maybe about 50%. What's happening is the eyes and the ears are sending signals all the time for your body at what plane line of existence you're on. Are you over here? Are you over here? Where are you? If there is a lapse between when the eye signal comes in and when the ear signal comes in, the body has to figure out which one is correct. And while it sends like a tracer, it sends a 3rd signal out. By the time that comes in, the eyes have actually moved, because your eyes will have like a little bit of movement in there. And so it triggers that, and they will actually get worse seizures. And someone that it might be kind of prone to seizures even for other reasons, that little bit will actually trigger them greater, and they'll have more and more of them. So.
Hi, my name's Susan Rusticia. I'm with Minla Technologies. We're presenting some technology here today. This is Linda Lohr, my co-presenter. Linda is a public speaker. I'm more of the quiet one and maybe a little bit nerdy about the technology. But one thing we both have in common is that we are devout chiropractic advocates, and we have worked in the chiropractic field for probably a combined 45 years, even though we're not that old. But so Linda's going to start off, and then I will be jumping in about the technology. And this afternoon, we'll actually get more into the technology one-on-one, so you'll have an opportunity to view this. So Linda Lohr.
So We're very, very fortunate that we live in this day and time. I say that because we now have technology that I never even imagined would exist. And so thank you all for coming to find out more about how you can get help or help others. So like Susan said, she's a distributor for the ES Tech that actually takes a look at the interstitial fluid of the body. Some of you may ask, what's interstitial fluid? It's the information highway of the body, and we can now take a look at it intact. Anytime you can take a look or measure fluids intact, it's the most accurate way to take a look at the overall health. I've been in the chiropractic field for 33 plus years, and yes, I started when I was 12. And I actually managed Susan's husband's practice, Ciro Restici, which is the Blair expert. That's what I call him. And I had triple whiplash in 1 year, so I know the importance of taking care of the spine, especially cervical. Let's see, what else can I say? I was in consulting for 27 years with Dr. Rollo Pinnell and Clinic Masters, so I've worked with 360 clinics all over the United States, and I was awed at just standard chiropractic. When I got involved with Ciro Restici, I was wowed. So that's my experience there. Wouldn't you like to know your healthcare dollars are spent well? I mean, really, because I don't know if anybody in this crowd has ever felt like a guinea pig, like you have something wrong and you've been to doctors and they just can't quite hone in on it. I mean, and you're wondering, am I spending all of these dollars on tests and things, and are they ever going to get accurate with it? Because you know what? There's a lot of relief when you finally have something that's identified. And then experience a system with scans this afternoon. That's pretty phenomenal. You're going to be able to do that. Meniere's disease and trigeminal neuralgia. I am not an expert. The people who suffer from this and deal with it are. What I know is it's inner ear, sensory perception, vertigo, imbalance, hearing loss, pressure, ringing, or tinnitus, which I have had for 17 years. Ranges in intensity, mild to chronic. My gosh, it sounds like you're suffering from a hangover all the time. Signs and symptoms. Dizziness, severe hearing loss, tinnitus, pressure, and then the attacks, minutes to hours. Nausea, vomiting, sweating, fainting, creates sensitivity to sounds and noises, can affect eye coordination. Jerky eyes, usually one. Migraines that last over 24 hours. I had cluster migraines for 10 years. You think it's going away, and then it comes back with a vengeance. And then before you know it, after 10 of these, you're in the hospital. I know what that's like. It's not fun. Contributing factors of Meniere's and/or trigeminal neuralgia, layered syndrome. Birth can come from birth, right? Head trauma, whiplash, vertebral subluxation and nerve interference, immune issues, excess fluid in the inner ear. The doctor talked about all of this, upper respiratory, and the complications. Excess salt can be exacerbated by excess salt, stress, smoking, alcohol, aspirin, middle ear infection, herpes sometimes present, hyper or hypothyroidism, and MS. Man. So diagnosis is difficult, right? Misdiagnosis is the #1 cause of death. It is. Results in the wrong drugs prescribed, wrong treatment given, no account for biological individuality. By definition, diagnosis is identification by process of elimination of the nature of anything. And isn't that what we want to do? We want to eliminate interference. What's creating an optimum level of health?
But it does have a combination of technologies now, as we had talked about before. But we're able to actually look at cell damage, the autonomic nervous system activity, hemodynamic, whether there's constriction or dilation, viscosity, ATP production, sodium, potassium, blood volume, water balance, cell damage, fat mass, SpO2. So what we're doing is putting all of these technologies to get a global view of the body to establish a baseline so that doctors can monitor your progress no matter what you're doing. It had this. Well, I'll be showing you in just a moment how it has such great applications to chiropractic. I forgot I got to go. Because my husband is also a Blair doctor, and I will say this: I would love to. My husband was so excited that I was coming to support Dr. Burkhan in this because we know that there's not enough upper cervical chiropractors in the world, and it's a difficult process to learn, you know, to go on and be a Blair-specific upper cervical, and that's not the only thing in the world, but it's absolutely miracle providing. We see miracles in our office every day. So the one thing that I can say is if you have an opportunity, I don't care how far you have to drive to see Dr. Burkhan, it is life-changing. And we think it's miracles when we're in an office and we see this, we see people like with trigeminal neuralgia or Meniere's have miraculous recovery, that they can function again in life, and to be able to drive a distance to have that happen, to light up your life, we think it's miracles. It's really it's a physiological thing that happens, and that's why this scan is so important and why I took off in chiropractic world. This is a medical device. It was created for the medical world, but Dr. Merrick had the insight to see that it really had chiropractic application, and my husband gave him his first chiropractic adjustment. What he said to my husband was, do you realize that you can now show down to the tissue level that chiropractic works? And so that's what we're really, really excited about. So I've been traveling the country working with chiropractors, and I've heard of the Tomasis. I've always wanted to meet you guys. You guys you rock, you know.
After about 12 years, I had the last 2 years the pain came and it never went away. And I was so frightened, and then I started getting mad, and then I kept just thinking, why me? What is this? Who am I? Why are you doing this? And all of a sudden I hear a voice, and this voice says, James, that's enough. You've done enough. Come on up. Come on up. And I thought, wow, are you saying kill myself? I couldn't get an answer, so I kept praying about it, and then I heard it again. No, it's enough. Come on up. Come on. We had a pistol in the drawer, and that was just for protection. In Oklahoma, you protect your property and you protect your family. And I thought, God, I'm a Christian. How do I do that? But he's asking me to come, so how do I do that? So I thought, well, I'll just shoot myself. Which doesn't sound like a smart thing to do, but when you're that hurting and that much, and I got so discouraged and I was so hopeless, there was no chance of getting out of this. Everybody had a deal going somewhere, but nobody had an answer that would stop this. So I decided, okay, I would. I'd kill myself. Rhonda had one last child at home, and that boy was in soccer practice. And on Tuesdays, Rhonda would pick him up at school and take him to the soccer practice and wait for him and then bring him back home. The house would be empty. And I thought, I don't want my wife to hear the gunshot. I just don't. It's probably not a big deal, but it was a very big deal to me. So I thought, okay, I won't do it. I'll do it then. I'll do it 5 o'clock Tuesday. I'm going to kill myself because the house is empty and she won't hear it, and I'm out of here. And the minute I made the decision that I'm going to kill myself, everything seemed to go away. The pain started to dissipate. I started feeling better, a little bit stronger. I was a very weak person, of course, but I felt very strong and very capable. I could take control of my life again. I wouldn't have that pain telling me what to do. I wouldn't have myself so depressed I couldn't see straight. Kill yourself, and it's over. You don't have to worry about it anymore. I can now understand how a boy can go out an 88-story window and kill himself. I can see how a woman driving her car can pull right in front of that semi and kill herself. I can see how they do that. That spirit of suicide comes down on you when you feel so hopeless there's no way out of this mess. So that was on a Thursday. Rhonda on Friday went to the grocery store. I was in pretty bad shape at that time, and she'd run upstairs and said, I'm going to the grocery store. Don't do anything stupid. And I thought, God, I'm not killing myself till Tuesday. Give me a break. Leave me alone. So anyway, she goes. She'd been told that he's very dangerous. Don't leave him alone. So anyway, she went and she got it. But the nice thing about that trip was there was a lady on the radio talking about upper cervical. She says, do you have pain? You've been told you're just going to have to learn to live with it. You've just been told that, you know, this is the best it ever gets. It doesn't, whatever. And she answered yes to every one of those for me. And so the lady said, call. She did. She says, where do you live? And I said, answer the phone, you bet. She said, Norman, Oklahoma. And she says, well, you're close to Oklahoma City. There is an upper cervical doctor in Oklahoma City. So speak some hope into him. He's kind of discouraged just from the way you're talking. Speak some hope into him and bring him on up to the office. And she said, when? And she said, well, in this work, upper cervical work, we have to have specific x-rays. They won't work unless it's absolutely right. And she says, my x-ray unit is in, but they haven't certified it. And I don't get it certified till Monday, so you can see me on Tuesday. So she said, great. She ran upstairs and she said, boy, James, that upper cervical doctor called me. And I said, wait a minute, Rhonda. When you're in pain, you're not a good person. Just everything is kind of yucky. And I said, what's an upper cervical doctor? And she said, it's a chiropractor. And I went, oh, goody. I was really looking for a witch doctor. I was looking for someone that would shake some bones over me and say, woo, magic, hocus pocus, wave a wand, do something. I've been to chiropractors. I've been racked and stacked and cracked and what all they do, which is kind of cool, but didn't help me. And she says, she said, yeah, she says it is. And I believe it's from God, and I believe you're supposed to go there. And I said, really? And she said, yes. I said, okay. And she says, she gave us an appointment. I said, when? And she says, Tuesday. And I said, what time Tuesday? And she said, well, it's 10 in the morning. And I thought, again, I'm killing myself at 5. I can do it 10 o'clock. It's ridiculous. They're not going to do anything other than whatever, but it will appease her, and at least that's one more time I've been able to kind of take care of her. So I said, okay, we'll go. So come Tuesday, she gets me up out of bed. Hadn't been downstairs for 2 years. I went down on Christmas because I had a word for every one of our kids, my wife, from the Lord, and I wanted to give that. And it was really, I knew I was getting out of here, and I wanted to make peace with them and amends with them because I knew I wouldn't be around them anymore. And so she dresses me. She puts me in the car. We drive up to Oklahoma City. I walk into the office, and it's just got opened. And obviously, there's nobody in there. The place is empty except this long hall. And I see her walking towards me. And she's tall, about 6'5", got big blue eyes. She's extremely good looking. She's got hair like this that only a woman could do when they stick their finger in that socket and their hair goes mwah, like that. So I'm looking at it and I'm thinking, well, she's a nice show before it's over. I think it's cool. So, I mean, you get crazy when you're going to kill yourself. You do not have the right thinking. Your brain is going in every direction. So anyway, she walks up and shakes my hand, and I said, hey, how are you? And she says, listen, do you know what we're going to do today? And I said, no, I don't have a clue. And she says, well, we're going to get your head on straight. And I said, really? And she said, yeah, we're going to get your head on straight. She said, do you remember when you were a little boy, James, and you were kind of naughty, and your mother would look at you and she'd say, you better get your head on straight? And I thought, wow, my mom used to say that to me a lot. And she said, well, that's basically what we're going to do. She said, I'm going to take 3 shots or 3 x-rays of you specific to see the head and neck relationship and see where your head is. And then we're going to straighten it out. And I said, okay. So she took me back, took the shots. I waited in the waiting room. She got them developed. Come walking in and looked at them, and she was right. My head, as you looked right at the skull, was tilted. And it was also a little forward. And I was 59 years old at the time, and my back was humping because my head was forward. And so I was walking like this, and my back was bowing. It's because our back loves us so much, my head is like a bowling ball falling off, and the gravity is taking over. It's trying to get underneath my head to hold it up in place, but my head's forward. She says, so we're going to look at that. I said, okay. So she took me back there, laid me on a table, did her adjustment. So I didn't get a pop and a crackle and a snap, and I felt a little disappointed. Wasn't anything like I thought I was going to get. And I didn't want what I thought I was going to get, but she did. She touched me just very lightly right underneath the earlobe. She did that about 3 or 4 times, and then she says, I think we have it. And I thought, really? I haven't done anything, but okay. But she says, to make certain, let's go back and take a post x-ray. Let's make certain that it is. So she took me back in, took the shot. I'm sitting in the waiting room. She brings it back out and shows me. This one is tilted. This one is now straight. And I thought, wow. And she says, and it's moving back. And she says, eventually that hump, we caught it soon enough, is going to straighten up, and you're going to stand pretty good. I said, really? I said, okay. I said, now what? And she says, well, I want you to go home, and I'll see you on Friday, and I want you to let your body heal itself. And I thought, wow. I'm 59 years old, and my body hasn't healed anything. Now you're going to have me go home, and it's going to stop this. My body is going to stop this. She said, it'll be all right. And I walked out and got in the car, and I waited on Rhonda to come. And about 10 minutes later, she got in the car, and I said, Rhonda, did you pay her? And she said, well, of course. And I went, ooh, ooh, what a waste of money. I said, this hurts more than it did when I walked into her office, and it's killing me now. I can't stand it. Just take me home. People in pain are not really great mates. They're really not people that just love on you and all that. They are like, leave me alone. We had children. I didn't even want them in the bedroom. I didn't want them touching me. Don't turn that light on. Don't come up against me. Don't talk so loud. I come to find out later that my kids didn't like me. They thought I was a real ogre because I was through those formative years. I was pretty yucky. It's hard to believe, I know, but I thought, wow. Anyway. So I get up, I get in the bed, 45 minutes goes by, and the first time in 2 years, now pain, facial pain especially, has no soft tissue worries, so it isn't like somebody slugged us. You can't see anything. It looks the same with or without the pain. There's no change. My pain stopped for 10 seconds. I screamed at Rhonda while it would stop, and she came running upstairs, but by the time she got there, it was back again, and it was hurting so bad I couldn't believe it, and I'm madder again. I know you wouldn't understand that, but I am really upset now. So I told her, just get out of the bedroom in the kindest words I could. And, oh. And anyway, about an hour later, she left. I could hear the garage door, and she went to get Ryan at school and take him. And I'm laying there, and in Oklahoma in those days, it was very high-tech, very high-tech. Do you remember those old radios, clock radios that had the clocks where the numbers went click, flipped over?
I'm much too young to remember
that. You have seen them, though you've read stories about them. Okay. Well, this is flipping over, and I'm waiting to go 500, and again it stopped. And this time, it took about 25 seconds of no pain. And I knew instantly, I didn't know what it was, but I knew instantly that God had put something in her hands, something in these upper cervical doctors' hands that could take dominion over this beast that was killing me. I mean, we had tried everything. Everything you can think of, we tried. It would not do it. She touches me, and my body begins working on it and stops the pain. And I, of course, start thanking God, and I know immediately that I'm not killing myself. I also realized, too, that it wasn't God that asked me to kill myself. Just me wanting it out. Anyway, her name is Jennifer. She lives in Oklahoma. Can we give her a hand? She's gone on to a greater calling than upper cervical, by the way. She's now a mother. Thank God for mothers. She's now a mother. In the meantime, I'm back in church about 3 weeks later. I had 3 adjustments. Pain was totally gone. I've been on a maintenance program since then, so I have to keep it in check. To give you, just to answer some questions that you may be asking, I haven't had a pain in 5 years. When it does come, I'm able to get it corrected, and it goes away again quickly. It's been, what, 12 years? 12. Could I have some water, too? Let me have some of that. Ooh. It's been 12 years. I haven't had an aspirin. And I was on all of them. Not an aspirin. Able to lay my head down and sleep instantly. Don't think about it. I just lay my head down, I'm out. Nothing. I haven't been to the drugstore other than to, no, I don't go to drugstores. I don't do that. The point being is that this works. For me, it worked. there's a space there, and when this guy goes in there, it fits like that or like that, something. I told you, I'm not very technical. I'm just the guy in here that got well and is able to come and tell you about it and maybe perhaps speak hope into you. When everybody else has got all kinds of technical stuff, I've only got hope to give to you that you can get out of this deal. Anyway, that space between there, can you see that space? That's where our brainstem goes. If we're all on a mission field trip with us, which I'd love for you all to come with us sometime, most in Africa call that the mouth of God. The mouth of God, if you can imagine. Get the mouth open, clear that brainstem up, and allow that breath that he blew into the dust that made us human to continue on. It'll knock the doo-doo out of whatever's in there bothering you. And it doesn't care what you got in there bothering you. And when that lady said to me, let your body heal yourself, that's basically what she was talking about. Now, this isn't technical. This isn't scientifically proven. This is a heart deal. This is a heart deal. You got to listen. You got to let your spirit be your guide. You got to think this is hocus pocus, or perhaps there's something to this. The nicest thing about it is you get to make up your own mind. I have no agenda. I don't sell you anything. I don't want anything from you. You haven't got anything that I want other than I love you. I love you. I want you well. I perhaps will never see you again unless we meet in heaven. Probably won't. But I can tell you, truly, I love you. I want you well. I don't want you sitting in a room like I sat for all those years when nobody told me about this. Nobody would even mention it. But did they all, or they had a new drug. Or whatever they had, I don't know. They were trying hard to just try to help us out, but it didn't work. So, I'm telling you from the bottom of my heart that this isn't an accident you're in this room. And I won't even ask you what's wrong with you, other than the TNs that are in the room, because I went through that so much. But I'll tell you another exciting part about this upper cervical once you get your head on straight. I suffered for years with ingrown toenails. Now, who would go to the greatest whatever he is to get your toenails fixed? You just cut them properly so they don't eat to your meat. Well, we're in Wyoming one time a few years later, and we discovered that my toenails had gone like this to this, straight. When I was born, I was told by my mother that you have hay fever, asthma, and you're allergic to cats. And you've always had those. The hay fever I loved because I didn't have to mow the lawn. My brother did. That was really cool. The asthma caused a lot of sympathy, and I loved that. What else? The cats, I didn't like them anyway. So it didn't bother me. When we started raising children, I says, you're a girl, and those are guys, and I don't care if they even own a cat. If they even walk by a cat, do not invite them into this house. Do not go out with them. I mean, I was really strict about cats. I'm in with an upper cervical doctor who, they call it innate, who let this innate thing start working through my body. It worked so beautifully that when it went around my face and it got to the pain trigeminal neuralgia, it says, what are you doing? And my pain says, I'm killing this jerk. What do you think? And my innate said, stop that. Stop it. And my pain went away. It did the same thing to my toenails. It did the same thing to my asthma. It did the same thing to my hay fever. We now own cats. I love cats. Cats are cool. The point being is he don't make junk. You don't have to be sold a new formula down the road that does. You only have to combine these 4 drugs to do it. You don't have to do that. All you have to do is let this begin to guide you. And if you're hearing what I'm saying today and it sounds kind of corny and wow, this is way too religious, great. Hey, I got nothing to sell you anyway. I have nothing in my hand to give you other than to tell you I love you and I want you to get well. If you make a decision to go and see this doctor, that doctor, or others that we now work with that we can help you find and get to, just go get well.
You get nobody patting you on the back because you got well. Because especially your TN guys, they don't even know you had it. So you got well, they don't care. So you get none of that. Nobody rushes out into the streets, oh, yeah, you got well. They don't care. And then I was walking around, and then I actually smiled, and I giggled, and I listened to what he had to say without complaining about me. And he said, what happened? I says, I don't know, something. This girl did some kind of hocus pocus. I'm not sure what she did, but the pain went away. His arm had his shoulder had had an operation. It sagged down. Painful all the time. Been told I'm going to have to learn to live with it too. And so we suggested go see this upper cervical doctor. And he said, why? And he said, well, to stop that. And he says, that's not going to help. They're working there, and this is down here, and that isn't going to help. And his mom said, go, do that. And he did. Today, he's an upper cervical doctor. He operates in South Carolina. His shoulder came back, the pain went away, and now he is giving that out because it was given to him to help us. He has no drugs to sell you. He has no deals to put on the table. He has no great thing. 5 minutes. I just love her. So anyway, he's a great doctor. Little Ryan, I told you about, the little guy, he grew up to be about 6'6", no, about 6'4", 6'3". Weightlifter. He didn't like wrestling because wrestling, those guys, he says, boy, they really work out. He was growing up watching his brothers working out. He said, I can't do that. I'm going to be a football player. So he did. And we had a championship, state champion football player. The team won state championship. He's a good kid. He now is in Sherman, the same place where Dr. Burkan went in South Carolina. He's now in school in his second year of chiropractic. He wanted to be an upper cervical doctor. Not because so much of me. He always had a problem with me because of my attitude. He did like that it changed, and that was pretty good. We became buddies and friends finally. He did it because he went on mission trips with us when he was 12, 13, 14 years old. And we'd take these upper cervical doctors out, and we did it in the field. We'd set up in a park. We had 44 doctors we worked with. Today we work with 1,760 of them. Thanks.
So anyway, they got together with this gentleman I'm talking about, Greg Buchanan in Australia. I tried to bring them together, and the chemistry was there, and they started an organization just to get the word out there, and they've just worked really, really hard.
You know, technology is everything, and there's a timing for everything, and today is the time for technology to come and validate the power that's in the upper cervical corrections. And technology is what allowed us to meet Greg Buchanan. But anyway, the Upper Cervical Advocates was launched in Australia between James and Greg and I in February of 2007. I came back, and in 2 months we made it a nonprofit, and it's an educational 503c9 so that it's educational. And that's what we do. We develop marketing and educational materials and have a website, uppercervicaladvocates.com, where people can go. On the, I was telling one of the doctors over here, on the links page we posted a YouTube video that illustrates the trigeminal nerve, where it comes up through the atlas bone and why the effects are there. But the Advocates program, it's right now 12 o'clock, is a $10 annual fee membership, and we also have marketing materials to help you promote your upper cervical doctor and education. So, time up. Thank you very much.
Thank you, Jane.
Very nice.
So, welcome to Health Talk 4. If you haven't seen Health Talk before, Health Talk 1 was, what, maybe about 6 years ago?
About 6.
And interviewed the Tomasis, and James' book, What Time Tuesday? It was about trigeminal neuralgia, and I talked a little bit about my Meniere's research, which I was just getting going pretty good then. And then we had, a couple years later, we had Health Talk 2, where you interviewed some of my patients, and they gave some testimonials. And then a year ago, June, once a year I do a Meniere's seminar nationally, and we had one at our office and in the conference room, and they had this set up with the Community Media Center, GRTV, filmed it. And then this year we had that one, and you joined us in California, Ventura. And that went really well. We had, what, 70-some people, most of them with Meniere's, and it was really, it was swamped. So that was the last one that we did, and we were going to do another one next spring. But actually, James had a problem with vertigo, which was different than TN, but I believe the cause is the same. So he came and said that he needed some treatments. And I said, well, we'll put on a little shindig and raise money for your tickets, because Rhonda will tell you a little bit about the upper cervical advocacy program that they do. Because a lot of people don't know that there's alternatives to drugs and surgeries for some of these horrible diseases. So I started with Meniere's, and then I added trigeminal neuralgia because of James. And I treat it the same way with upper cervical chiropractic. It's a little bit harder to control than Meniere's. Actually, I find Meniere's relatively easy. I mean, maybe it's, I shouldn't say that, but actually it's cake. Trigeminal is a little harder. But then something happened last summer, and I don't know, I think lots of people are lucky enough in their careers that one thing happens and it made it all worthwhile. Whether you're volunteering for something and had to take a one-week class, or like me, you specialized in something and went to college for 12 years. But my receptionist came back and she said, well, you're going to have to come and listen to this message. I said, just write it down, I'm busy. She says, I can't pronounce it, so I can't write it down. So Joanne's daughter, Sandra, says, you know, can you help my mother? She has glossopharyngeal neuralgia with spastic dystonia. And the receptionist says, what is that? I said, I don't know, I never heard of it, but let me go get one of my medical books. And so I looked it up, and it had one sentence in there, and it said, we don't know anything about it, treat it like trigeminal neuralgia. And if you look under trigeminal neuralgia, you don't find very much either. This is the Merck manual. So I said, well, if the medical doctors don't understand it, it's probably a chiropractic problem, and I can probably help her. If they're shopping for a doctor, they probably have some records. So why don't you ask them to fax me some of her paperwork? And so they sent me 53 pages. And I sped read it during lunch, and I used my yellow magic marker and marked everything that I found relevant. And I had two questions when they came in and sat down. Now, bear in mind, Joanne couldn't talk. She could whisper a couple of words, but it would cause her so much pain, she would just go into these horrible tremors. Now, the receptionist came back to my room and said, you got to get this woman out of my waiting room. She goes, everyone is crying. And she just had alligator tears just dripping off of her cheeks. I said, okay, send her back. So her daughter was doing the interpreting, and the first question I asked, I said, how did you get concussion when you were 16? And her daughter said she didn't, and she jabbed her. She put up 2 fingers. The first one was skiing, so that you didn't hit your little dog when you fell on your head. And the second one was ice skating, where you fell back and hit your head, and everyone on the pond stopped to look because they heard it. It was so loud. So lots of the people I see hurt themselves when they're in high school or college, and then they move on and get married, and they forget about these things that they did. She didn't tell her children because she quit skiing, she quit ice skating. It never came up in conversation. She didn't know anything about it. So the second thing that I had written down is what I thought her listing was. A listing is an abbreviation of a misalignment of a bone, And what I find is a correlation between people that have these cranial nerve problems on one side of their body, that their atlas, the top bone, is moved in the opposite direction and backwards. So I wrote down PIL, which is how I figured I would adjust her, but of course I would never adjust anybody without an x-ray. So that brings us to when I'm x-raying her, and those of you that know me, which is pretty much all of you, I just think out loud. I don't think about what I'm going to say before I say it. It's just this stream of consciousness, and I say things sometimes and I think, maybe I shouldn't have said that. So I got her in front of it, and I saw her, and I can't tell you how it looked. It was a feeling. And I said, "You've been praying a lot, haven't you?" She shook her head, yes. And without thinking, I said, "Well, your prayers are going to be answered." And I thought, where do I get off saying something like that? I'm getting this poor little old lady's hopes up so high, and I never even heard of this morning. This isn't this afternoon. That morning, I'd never heard of this disease. And I thought, oh, I shouldn't have said that. So I adjusted her. Your daughter thought I broke her neck. And she got up and we had a nice chat.
Yes, that's true.
Anything you'd like to add to that? Is that pretty close? Or?
That is pretty close. Yep. Real close.
What about your daughter? Do you think the microphone's over there if you want to add your 2 cents to...
I don't need a microphone, do I?
I don't know. Are you picking it up good enough from where she is? Or it's wireless, you could bring it over to her.
Perfect. Perfect.
Well, I mean, I'm saying all this, but this is my version. Maybe your version is like a little different.
It was so dramatic that my mother, who lived in North Dakota then, decided to move to Michigan. She's living here in Michigan now because of the treatment that we got from you. And it's just been amazing. She went from severe pain where she couldn't talk to being able to live.
Needing constant supervision and care.
Oh, absolutely. She was on gabapentin, and the neurologist called it an overdose because that was the only thing he could figure out to treat her. What it did is made her sleep all the time, so there was no quality of life. And my brothers and sisters and I had a powwow at Boise, Idaho, where my sister lives, and we were there for a wedding, and we just said, this isn't good, what can we do? And my sister-in-law got on the internet and found that you worked with trigeminal neuralgia, and we thought, well, trigeminal neuralgia, glossopharyngeal neuralgia, maybe.
Same ballpark.
So that's what we called you, and we were amazed that you had actually read all our medical records when we got there, and you knew things that had happened years ago that I'd forgotten about, and things that I'd never known about.
Well, the thing is the paperwork went back 10 years when she developed a cough that continually got worse until she couldn't talk, and she started getting these electrical shock pains in her throat. And what I keep bugging people in the case history is, but what about before that? So the first time that she had a medical problem that interested me because of the Meniere's is she went deaf overnight in one ear when she was 31, and 7 months later went deaf in the other ear. So I'm thinking, well, that sounds kind of like Meniere's. So maybe these things are all tied together. So the Meniere's is the 8th cranial nerve. Now we're talking about the 9th cranial nerve. They run right together, so if one's pinched, the other one could be. So I'll just treat it like it was Meniere's, and I think it's going to work out. So, James.
Yes.
Why don't you talk a little bit about your book, What Time Tuesday?
Have we all read it? What Time Tuesday is a story of, it's a murder mystery. Kind of different to think about, but after you've read it, you see the murder mystery that was involved in it. I was involved in trigeminal neuralgia, which is the suicide disease. There is no cure. You can't go into a local Mayo clinic asking for a cure because there isn't. And so I'm on my deathbed, ready to pull the trigger on my pistol, but we have to safely go home. And my wife, thank God for Rhonda, she's out in the car getting groceries for the home, and she hears someone talk about a cervical doctor. So she gets very excited. She thinks it comes from the Lord. This is a way. This is a. And when she comes home, I look at her and she's telling me, and I said, Rhonda, what's an upper cervical doctor? She says, it's a chiropractor. And I went, oh, goody. I was so far gone that I was really looking for a witch doctor or something that would shake some bones or something and I'd be okay. But it wasn't that. But my faith is in the Lord, of course, and my wife has been always on my side, by my side, showing me things. So I listened to her. She got me an appointment with a woman, not unlike you, a young lady that had just gone through school. In fact, she just opened her office. In fact, she just got us into her office on Tuesday because the x-rays were being set up specifically on Monday, and I was virtually one of the first patients. And anyway, we were talking about brain-to-body communication. I mean, we really will build it in such a way that we can cure ourselves. Now, the pharmacies don't believe that, and certainly others don't, but we really will. We're put in that position. I mean, he had said, you know, I want buddies, and I want you guys to be with me forever. So he set us in such a way that we could actually heal ourselves. But if that brain-to-body communication gets distorted or moved or like a hose kink and you can't water the garden, we get sick. And along comes Dr. Michael. They're the specialists that actually study that, look at that, and see that, test it, and then say, oh, well, maybe if I take this kink out of the hose, that communication between that pain and mind within the face, we all know what a taser is like, tasered by a place. Hopefully, but that's what trigeminal is. You're tasered in the face constantly. Those electric shocks that you're getting in your throat, same thing. They study, see it, and understand that if that bone is moved in a certain way, which is the upper cervical bones, if I can straighten that out, the kink is gone, and then that communication starts again, and you actually start getting well. Now, for me, it was all focus focus. I went through it. It was wonderful. I didn't believe it because I was ignorant of it. I didn't know it. I was raised out of a medicine cabinet. If you didn't go to the pharmacy and get some drugs, you don't get well. And then I heard the truth from my wife and the doctors, and I began to experiment. Now, it's been 15 years I've gone through that. I still have problems. We all do. I get older. I'm almost 74, and things happen. But because of a relationship with, like, Dr. Michael, if you have it, you just call and say, what about this? He says, well, that's
And back then, when we were, first got together, when you said upper cervical specific chiropractic, people were like, what? And now it's kind of like, I think I heard something about that because it has been on the national news. And so it's come a long ways, and it's not a new technique. It's an old technique from 1931. It's something a lot of people don't realize. And B.J. Palmer, the son of D.D. Palmer, D.D. started chiropractic in 1895, and together they opened the first college. And he had a research hospital that was half medical and half chiropractic, and he had it until 1961 when he passed away, and then his son took over, who was more into the business, and because the research was losing money, he shut it down. And where I picked up is where he left off in 1961. I picked up where he left off. He actually wrote, together D.D. and B.J. wrote 40 books. They're called green books. He made them himself, and he liked to save money, so he only got green covers because that was the cheapest.
How cute.
So you heard Luella Harris, which is an advocate, and then you became an advocate, and about the same time, going back 10, 12 years ago, Greg Buchanan in Australia flew me to Australia, and he was a big shot in Microsoft and wanted to go back to work, and he had vertigo after having his head pile drive. He was a semi-professional rugby player. And he felt so much better that he said, I'm not going back to work, I'm going to become an advocate. And he's made movies, and he's traveled all over the world. He has a fantastic website. It's upcspine.com. A lot of these things will be at the end of the program for people that are watching on the internet. And the show will be out on DVD that you can get copies of. later on. So the Tomasis got together with Greg and started a group, and that's sort of what one of the things we're celebrating tonight. So Rhonda, why don't you talk a little bit about the group?
Oh, am I on?
Yes, sir. Your mic's not working?
I guess not.
Okay.
Or maybe my voice is soft and you guys just want a double mic. Oh, it's his mic. Okay.
Sorry.
Wonderful. James and I flew to Australia in 2007 because we had a vision for a year that we'd been talking with Greg Buchanan about. Never met the man, but over email technology, isn't the internet wonderful? He began to share his heart, and we could see that he was a like-minded advocate. All we want to do is tell the whole world what upper cervical is. Because of our own experience, I had 10-day menstrual cycles every month with huge blood clots, with an ultrasound that showed my uterus was full of fibroid tumors, had a chronic cough, and I had arthritis in these fingers, which was hereditary, I was told, because both my grandmothers had those. My conditions weren't that painful. They were very annoying. James's were painful, and Joanne's was extremely painful. But I want to bring that point up, and Greg's was annoying because the Meniere's. The room would spin if he tried to do anything, and he's a computer tech. He has 3 engineering degrees, finance engineering and something else. Anyway, we were looking for people that had a passion like we did, people who wanted to learn enough about upper cervical, not to be a doctor, but just to go out in their local communities and have the tools to share what upper cervical chiropractic is. And we are not against chiropractic. We are for chiropractic. It's a beautiful science. It's been maligned, or whatever the right word would be, by certain people who wanted to say that these aren't real doctors. Have you ever heard that? Oh, it's the medical doctors that dispense the drugs. Excuse me. I love medical doctors too, have some good friends. But I'm not for putting foreign substances into my body. And I'm not for people that are forced into that or having something cut out of them. We believed there was a better way. So when we found upper cervical chiropractic, I was already a believer in general chiropractic. Took my children at the age of 2 to chiropractors. But we decided we would be proactive along that line. Greg wanted to produce a movie, which I don't know if you've seen The Power of Upper Cervical or not. He produced that, funded it, 60 Minutes film crew came in. Then Christina and Billy Beretta, who had trained under Jim Henson with the Muppets, decided they wanted to take on the editing of 60 minutes of about, I don't know how many, 14 different doctors that we had fly into Las Vegas to be interviewed. So during our tenure in Australia, that's what we did. We set up the Power of Upper Cervical movie, came back and let the Berettas do the filming with 60 minutes. Greg paid for it and produced it. He has a database of worldwide upper cervical doctors on his website. So in James's What Time Tuesday book and on whattimetuesday.com, we refer people to Greg's website because there's no charge. If a doctor is legitimate and does practice upper cervical, we say, go there to find one.
So I'll just point out, to become a chiropractor, you get a 4-year pre-med degree, which is the same that you become a veterinarian, a medical doctor, a chiropractor, all the same, the 4 years. And then you go to 4 years of graduate school, which is 4 years solid. You don't get summers off. And you take 36 credits each quarter, which means you're in class for 36 hours a week. And then you have to go find patients that will let you work on them to get through the clinic. And you're constantly taking a set of 4 national boards, which are difficult, and a certain percentage of people have to fail. So you're competing against all of your classmates and other ones across the country. And so then, after you get home, then you have to study for your boards. So it's a long 4 years. So when you get done, you're a couple $100,000 in debt and you're ready to go to work. But you can choose to go back for another year of postgraduate training and be upper cervical specific. Not too many people do it because we don't get paid any more than the ones that don't. And so now you're going further and further into debt. So only 2% of chiropractors go on. But when we started there, I'm ballparking, there were 1,000 when you first started, and now there's more like 2,000. I don't.
2,600.
2,600. The last time I checked, there was about 2,000. So it's making a comeback.
It is definitely making a comeback, and the reason it's making a comeback is because doctors like Dr. Burkhan put their own money not only into their patients but into publishing papers of research. And their difficulty is finding medical doctors who are willing to back them on their research and then sign their John Heritage.
Well, I started out, for the first 5 years, I spoke to chiropractors, and I spoke to 1,000. Yes. And then I told Jane, I said, I think we should try to speak to some medical doctors, because the chiropractors know about it. Yes. And so for 5 years, I spoke to medical doctors, and the highlight of that was speaking in Japan to 500 ear, nose, and throat surgeons last year. And now I'm splitting it up between medical doctors and chiropractors. We just did IRAPS at Sherman College, and you attended that. That was one of the last ones we did. So we're making really good progress. So most of these health talks, we're kind of like talking about all these symptoms and stuff, and this is more of a celebration because people are starting to find out about it.
They are finding out about it. We get calls and emails from, I've had requests for doctors in Ireland, Greece, Guam, China.
Well, with the internet, I put an abstract about Joanne on there, and someone came from Saudi Arabia with glossopharyngeal neuralgia and got fixed. And now he's going to chiropractic school. So, you know, that's the beauty of the internet, is you can find out about these things. So speaking of such things, I want to make a couple of thanks tonight. I want to thank the Community Media Center and GRTV. I had a couple patients ask me what my hobby was, and I thought, and I said, I don't. All I do is work. And they go, oh, that's not normal. They said, you should go down, and you have a good voice. You should be on the radio. You should be on WYCE. So I went down, and I took the class. I was on once. And then the manager said, you never took the orientation class. I said, nobody said there was one. I'll take it. I've taken classes. I've been in college for 25 years of my life. I'll take the class, $20. And they said, oh yeah, we have the radio and we also have television. And I'm like, well, I saw it at the other end of the building, but I didn't dare go down there. I thought I'd get in trouble. I'm like, oh, I can use that stuff too? I like TV better than radio. I'm going to do something. So I did the editing class and actually did a movie when I worked for Evel Knievel and edited it. That was my first project. And then after volunteering a certain amount of time, you get to do your own show. So that's how we did Health Talk. Yes, dear? Well, I edited your music programs. Of course I did. Now you made me lose my train of thought. Speaking of trains, we can throw this in. When we get this section done, they have to take the cameras out. I recommend that, because it stops like at 9, that you can go and look at the Polar Express. And then from like 9 to 10, we can look at the Christmas trees when the crowds are gone, and we have the whole place to ourselves, and you can still come in here and eat and drink. I wanted to thank Fred. I had the pleasure of having dinner with him here about 10 years ago, and as we all know, he just passed away. So this wouldn't be here if it wasn't for him. And it's not a small thing. And we could spend the half hour talking about Frederick Fire and what he's done for Grand Rapids, but you know, we've heard a lot about it. But I wanted to say thanks, because this is just a wonderful place. And I have a dedication award that I'd like to give to Tony. Yes. Tony's been at every event that we've had, and she hasn't missed a day's work in 2 years. Some of us have that old-fashioned work ethic, and some people don't. Oh yeah, and when we come back after you look, they break down and you see some of the train or whatever you want to see. Then we're going to have some dessert and do the gift exchange and just hang out.
May I ask you one last question?
No.
No.
That's okay. Yes.
When we attended the IRAPS, which is the Art and Philosophy of Chiropractic seminar, Dr. Burkhan was presenting a paper there, and he had a PowerPoint, and he was correlating the symptoms of people that have Meniere's and TN, and there were two other things that you had up there, and Parkinson's, and what was the fourth one?
Well, well, there's Bell palsy and migraines and these one-sided things.
Yes.
But we were. Can I say where'd Jane go?
She's right there.
Oh, okay. Yeah, she's trying to say. We were at a beer tasting dinner, and I was talking to the guy next to me, and she gave him a card, and he goes, Meniere's. My dad had Meniere's. And I said, he's passed? And he goes, yeah. And I said, well, that's too bad. Meniere's is bad. And he goes, well, actually, it wasn't that bad because then he got Parkinson's, and that was worse. And I said, well, they're both caused by the same thing. But anyway.
Yes.
So I have a very short story here that is my favorite short story. I rarely get through it without crying, but most of you know me well enough that I don't think that'll bother you too much. So this one is number 22. B.J. Palmer wrote it in 1949 at the Grove Park Inn in North Carolina, where Jane and I had our honeymoon. B.J.'s pictures is on the wall. And it's called Lady, Are You Rich? They huddled inside the storm door, 2 children in ragged, outgrown coats. Any old papers, lady? I was busy. I wanted to say no, until I looked down at their feet. Thin little sandals sopped with sleep. Come in and I'll make you a cup of hot cocoa. There was no conversation. Their soggy sandals left marks upon the hearthstone. Cocoa and toast with jam to fortify against the chill outside. The silence in the front room struck through to me, so I looked in. The girl held the empty cup in her hands, looking at it. The boy asked me in a flat voice, Lady, are you rich? Am I rich? Mercy, no. I looked at my shabby slipcovers. The girl put the cup back into its saucer, carefully. Your cups match your saucers. Her voice was old with a hunger that was not of the stomach. They left then, holding their bundles of paper against the wind. They hadn't said thank you. They didn't need to. Bear with me. I don't know why I like this so much. This is the only story in the book that B.J. didn't write. A lady sent it to him. I've never been able to figure out who she is, but I do know why he put it in. They had done more than that. Plain blue pottery cups and saucers, but they matched. I tested the potatoes and I stirred the gravy. Potatoes and gravy, a roof over our heads. My man with a good steady job. These things matched too. I moved the chairs back from the fire and tidied the living room. The muddy prints of the small sandals were still wet upon my hearth. I let them be. I want them there, in case I ever forget how very rich I am.
Sky
So did anybody have any questions or comments or testimonials in closing? Enjoy.
Thank you.
What's that? We give them back to that guy. Yeah.